Welcome to the 360 Degrees SCD Hub live broadcast show and interactive community chat. This show is designed to do three things. 1. Empower those living with sickle cell disease. 2. Educate the medical community to improve overall care. And 3. Encourage the general public to learn more and how to support this community affected by this disease by downloading our app and joining our community platforms. Whether you are living with sickle cell disease, part of the medical community, or the general public, our goal is to connect and unify everybody to improve care for all. This show is co-hosted by the Sickle Cell Foundation of Arizona and the Force for Health Network. Each month will feature special guests from our partner organizations and will include an interactive way for participants and viewers to interact with us. We encourage you lend your comments on our live streams and to download our free 360-degree SCD Hub app through the QR links below or by visiting our website at 360scdhub.org and join today. Together, we can make a difference for the entire SCD community. Now, let's meet today's co-hosts from the Sickle Cell Foundation and the Force for Health Network.
Rob Gillio. This is Lucy Howell, and we are coming to you live. We're having a little bit of, not tech issues at all, but there are, okay. So anyways, this is the third episode of our monthly insights for the Sickle Cell Foundation of Arizona. We partnered with them about 8 months ago, right? And they were funded with a HRSA grant, and we were able to create a new app and platform and just a new way to connect and communicate to the entire ecosystem of the sickle cell disease, starting here in the state of Arizona, right? My partner, Dr. Robert Gillio, is based in Pennsylvania. And then our fearless leader, Moses Akpan, who is the executive director of the Sickle Cell Foundation of Arizona, is normally joining us right now as co-host as well. And we will see if and when he joins. So I hope everything's okay with that. But June is too important a month, Rob, to cancel, right? Or to reschedule. So we said on with the show. So we are here to share with you some of the exciting events that are coming up on behalf of the Sickle Cell Foundation of Arizona and the partners with the Red Cross of Southern Arizona and Banner Health Plans. And so usually we start this show with just a couple of housekeeping issues. This is an interactive broadcast. And so we are live on Facebook and at YouTube and LinkedIn. And right now we're pushing to our Force for Health Network channels, although I did just share this on over to the Sickle Cell Foundation Facebook page. And so if you are watching and you're commenting, we will see those comments come in, and we may be able to go ahead and bring those into the show and talk about it. So that is the interactive component of the 360 SCD Hub Monthly Insights community chat. So I am based here in Tucson, Arizona, and I'm the CEO of the Force for Health. And so together we help amplify these population health issues, such as this for sickle cell. So Rob, those are kind of my opening thoughts here. And I know that we're excited to share maybe some tips for those living with sickle cell. I know that you're going to go ahead and take us on a 360 famous Dr. Rob Human Explorer tour to go inside the body. And then we'll go ahead and talk about what's coming up in June. If Moses does show up, we'll go ahead and extend this out normally to the 60 minutes that it normally is. And if something came up, because it is live and things do happen. And so if he happens to not show up, then we'll just cut it at 30 minutes and we will go on with the show. But those are some of my opening thoughts. What about you, Rob?
Sickle cell disease is something that you need to have patience with. And if you know someone who has a child with sickle cell or has sickle cell or is involved with this disease as a student or an employee, patience is the key. Stuff happens. It happens abruptly. It happens without warning. It is sometimes painful, sometimes dangerous, sometimes just a nuisance. So I'm using this in my mind as an example of, here's a man who's running the foundation and supporting many families and many professionals dealing with a tough disease. And I don't mind that he's not here right now. In fact, it's a good lesson for all of us when an employee doesn't show up, when a student doesn't show up, or when things don't work out as well as one would like. So I'm reminding people, anyone in the community, if you have sickle cell, we have an app and a platform that helps support you. If you're living with someone with sickle cell, if you're taking care of someone with sickle cell, or if you're just a neighbor in the community trying to figure out and understand, advance your health literacy, there's materials in the app and the platform online to help you out. So that's my opening thoughts is stuff happens, especially if you're dealing with kind of a heterozygote sickle cell situation where you have a propensity to have events happen or crises happen. So great deal of patience there. That's my opening thought, Lucy. And speaking of, along those lines, I see that Moses has joined us in our backstage waiting room. Hello, Moses. We're just talking about you a little bit.
Okay. Hello, fearless leader. Glad to see you.
Thank you. I was in Marana.
Oh, that's okay. We are actually live right now on Facebook, LinkedIn, and YouTube. And I was setting up the show saying, things happen. And if you happen to show up, then wonderful. We will extend it out the full hour like we normally do. We've got so many exciting things to talk about this month. There we go. See the coaching already taken place. You self-coached yourself and fixed the camera for yourself. Okay. And so, and if you didn't show up, we were going to cut it at 30, but we've got some tips for those living with sickle cell that we wanted to just review. That's straight out of the courses and the badges from the Academy. Rob has a nice 360 human explorer model that he wanted to go into. So maybe gets a little bit more technical, perhaps, or not. I think he was maybe trying to talk to the medical community about that. And then the main portion of this show today, Moses, is really getting a chance to talk about all the cool stuff that is going on with the Arizona Community Roundtable, with the Juneteenth festivities, with the Summer Health Challenge, and with the Family Conference Challenge. So we'll leave the big part of the show, the last 20, 30 minutes to talk about those things. But we did just finish kind of our executive reflections and thoughts around the roundtable. So I pass the baton to you, Moses. How are you doing? And what are your opening thoughts for this June Monthly Insights episode?
Well, thank you so much. It's exciting to be having this event, this broadcast, trying to reach as much of the public, partners, interested folks, the sickle cell community. This is quite exciting, and I give all the credit to you and Dr. Gilio and all the other supporting partners. June is a very busy month. I didn't think that this was going to be as busy as it is. It's like there's so many activities going on. But specifically, we are going to have June 7 Sickle Cell Roundtable, and we use that to usher in the World Sickle Cell Day. And so that's great. Working with the team, the Red Cross, Banner, the Sickle Cell Roundtable team. So look forward to that program that we're going to have. I believe Courtney was going to send us the final program today. Haven't checked my mail before this broadcast. So we will have that. And so there are a number of announcements. I don't know if this is the time to let the cat out of the bag, but there are a number of announcements that we are going to have. We're going to have the Summer Challenge. We're going to announce the Empowerment Group meeting that's going to take place on the 29th. Of course, we're going to announce the Family Education Conference and the giveaways. and the opportunity to interact. When we go to the family education conference, we have Vertex sponsoring us, we have Pfizer sponsoring us, we have Banner sponsoring us, and of course we have Force for Health. My goodness, can't get any better than that. So
those are great announcements. I'm excited by it, but Lucy, I have trouble keeping track of this stuff. I want to make sure people understand. All right, you have a graphic for this here, but later show me where I can find it in our app on the calendar as well. Because I think for anyone watching, if one goes to 360scdhub.org and logs in, creates an account, logs in, or downloads the app, everything we're talking about is here. And that's how I keep track of it, because Moses just keeps working and working and working on more events, more sponsorship, more resources for sickle cell patients. Arizona's lucky to have him, but I see this as a world resource. Show me where I get to that calendar, Lucy, please.
Sure.
There it is. Okay. Thank you. So let's go over those announcements again, if you could, you guys.
So I guess we'll flip then the agenda. I was going to really save these specific deep dives into these events for the latter part. I wanted to kind of go over quick tips, Moses, with living with sickle cell, and then Rob was going to take us through a 360 anatomy, and then the last part of it is just going to go deep dive into who the partners are, the calendar, and how people can get involved.
Sounds good. All right,
sounds good.
you.
Okay, well, wonderful. Well, one of the cool things in this 360 SCD hub that we're offering for free. So you'll notice there's QR codes along the bottom. This was a HRSA funded. And Rob, remind us what HRSA stands for those that don't live in the health grant world.
Health Research Services Administration. They fund programs that are validated and shown to create better outcomes for people, and they research those outcomes to make sure that what they fund is first rate. So to be involved with HRSA is one of the highest compliments I've ever had as a physician in terms of being able to build something with them, for them, and Moses.
Correct. And one of the stipulations about being a HRSA funded grant is that the Sickle Cell Foundation or the Force for Health, nobody can charge for it. This was a funded resource for at least 4 years. And so there's all these incredible kind of interactive and a full learning management system that can back the learning of all different types of levels. You'll notice over here, I could be logged out or logged in. If you're logged out, you can still have access to these courses. It's just that you won't be able to track if you've done them or earn points or anything like that, which is always a nice thing to have because there's no way that you're going to take all of the information at the same time. But if you are logged in, as I am here as Coach Lucy, you'll see some of the categories drop down. Let me put this over on this screen so I can actually see. And adults with sickle cell, collegiates, living with sickle cell is really a general category. So I'm going to go with living with sickle cell. And actually, let me go down. I was just realizing that this is the course that I wanted to show and bring up. And Rob will make a quick note. We need to tag this as living with sickle cell. It's missing the tag right there, but that's okay.
Oh dear.
So this particular course has just 6 steps to living with sickle cell that we just thought would be good to pull up kind of live as we're going through it. So you can kind of see some of just some quick tips, really. Then we'll talk about it. Part of this project included being able to reach out and work with students and fellow physicians and leaders. And so Rob was able to work with one of the students of the College of Medicine to just put a little quick welcome note on here. I was just going to play it really fast, and then we can go over those 6 steps. And then you can take us through a 360 on that. That's now, right. This happens to be based off of the CDC's report called Living with Sickle Cell. Not report, we'll call it guidelines. And so some of the things about just having a PDF and downloading it, you can't really tell what you've consumed or who's consumed what. So it was just kind of sort of nice to take that content and now lay it into a digital course so that you can track along the way. I'm just going to make her a little bigger here, and we'll just play it.
Lucy, your audio is not coming through.
Interesting that that's not coming through. So
a setting on the show. Let's just have people.
Yeah. Then you know what? I'm going to just pull it over here, and let's just go through this, Dr. Rob, as our Chief Medical Officer.
Okay. Well, first of all, that was Fatima Tall. She's a student, a medical student, and has had family member that died from sickle cell disease and felt strongly that she and her classmates should know more about it and also be an advocate. She's trying to help us take very complex medical information and have it be available for people that look like her, let's say, that are at her level or at the level of her cousin who died. The first point she makes is find good medical care. And as a physician with excellent medical training, I mean, come on, Rush Medical College, Mayo Clinic, I think I saw maybe one sickle cell disease patient in 40 years. If someone came into my ICU, I wouldn't know what to do without going to the books. I admit that right now. Fortunately for all of you with sickle cell, I'm retired. But the point is, being an advocate, to ask your doctors to make sure their practice is familiar with sickle cell disease is an important advocacy thing. I would suggest for a parent or a child, for physicians or caregivers in this learning management system inside the 360 Hub. There's some courses to get up to speed. There's some courses about transitioning patients from juvenile care to adult care. So finding good medical care becomes important. And I encourage doctors to learn what they can, get the CME they can get at a place like Banner Health or within this app even at some point. Share what you know. Secondly, regular checkups. Sometimes you can't spot, hear, or see different things. Sometimes the problems you have can lead to a murmur, can lead to a neurologic impairment, can lead to a finding in your eye that you can't see. So having a baseline so that when you get sick, someone knows what went right and what went wrong. It's the second thing. The third piece, prevent infections. Well, this is so important because think about it a second. When you get an infection, what often happens? You get a fever. When you get a fever, what happens? You burn oxygen more quickly. When you burn oxygen more quickly, the oxygen level in your blood drops. When the oxygen level in your blood drops, that hemoglobin molecule changes from a nice square clump of a state to a very straight one. And when that happens, it can cause a regular looking cell to sickle in its shape. And when that happens, those cells can be more likely to cause a clot. All right. So infections, fever, lower oxygen can really increase your chances of a crisis. Very important. So hand washing, staying away from people that are sick. It's important. It's obvious general things. Healthy habits, staying well hydrated. When you are dehydrated and your blood volume is lower, sometimes your red cells are closer together and they're more likely to cause a clot. A clot in the blood vessel leads to a crisis. Keep hydrated. Next suggestion the CDC had was look for clinical studies. They recognize that their doctors, the doctors that are looking at their literature, people like me, are maybe not in the place where they're seeing tens or dozens or hundreds or thousands of patients. Clinical studies usually are run by hematologists at centers that really know a lot about sickle cell and know the latest treatments. And there are new treatments, new medications, and even certain genetic related treatments available. And lastly, get support. Stigma is a big feature with sickle cell. You're going to feel like you're alone. If you're in a community that doesn't understand it, you need the support of friends, of family, maybe even community organizations, or maybe a group like within the app to be just one of the sickle family groups inside of the app. And I have a place where you can kind of hang out, much like you might in a Facebook group about a similar interest. That's one of the lessons within that course. There's a series of other topics that we could go into. I hope that helps you, Lucy, with what you wanted to see.
Yeah, that's great. And I was just kind of popping on up to groups as an example of what you were saying. And again, to kind of demonstrate the capabilities of both the online, this is on a large screen computer.
Yeah.
As well as a small screen app. That's one of the biggest, advantages and differences I see out there as we've worked through this project.
But are they coordinated? If I do a course on the app and then I do a course online, do I still get my points? And can I be in a group on the app? Is it the same group as when I'm online? I'm asking a leading question, but it was part of the specifications that Moses required.
Yes, absolutely. The answer is yes. So this is a mixed media platform designed to help enrich and support education, awareness, and empathy for the entire ecosystem, living with sickle cell, medical community, general public. Moses, now you are, a family with sickle cell history. I'm sensitive to bringing this up, but this is why you are so passionate, because you lived it as a father. And so are any of the tips that Rob just went over, how do you react to some of the tips that we just gave and to demonstrating some of the features of the platform we built together?
Thank you so much, Dr. Gilio and Lucy. The best testimony that I can give, and I look forward to our coaches, our other users putting out these testimonies so that the general public, the families, everybody can see. Is when I spoke with a mother, and she said, in fact, she's member of the coaches team that we are putting together. She said, I wish I had this tool, this app, 5 years, 7 years ago. It touched me deeply.
Yeah.
How much she did not know. That speaks for itself. So I pray and I wish that the community would connect with this app. There's nothing more I can say about that, because there is so much to learn. There is power in information. There is power in knowledge. You can't jump over. So I really wish to encourage everyone. I'm always careful when I talk about providers. And I know that, unfortunately, Dr. Tischler passed away. He's the founding member of the board. And when we first started this organization, he had a scholarship, a grant, and which he introduced sickle cell to these second-year medical students, and also to the senior students at the College of, I think it was at master's level, College of Nursing in Phoenix. That's how important it was. I think it was 2012 and 2013.
Wow.
To bring to visibility. So the information about sickle cell. So right now is not the time to panic, to get back into the closet and feel intimidated about the stigma. Sometimes it's our perception. It's not really that the public is doing that. It's just the way we perceive things. We internalize these things. Yeah. So I'd always say, love sickle cell. Because when you love sickle cell, you love yourself. If you love yourself, you love sickle cell. So you don't treat yourself badly. Don't treat people you love badly. So starting with yourself, love sickle cell, so you can take care of yourself. And the more you know, the better you understand.
No,
And
I love that. I think what you're making me want to share my screen and go into something, if you don't mind, if that would be all right. Because in terms of loving yourself with it, uh, with the sickle cell, I'd like to share my screen and I'll just verify that you're actually seeing what looks like an eyeball. Am I correct? Or part of one?
yes, we will.
All right. And so if you understand, this, I'll go back to it, but this is part of the curriculum that's in your app where people can manipulate things just like I am. This is the eyeball looking from the side. Looking at the front, I'm showing only half, the pupil, the iris, and this is called the conjunctival surface. Sometimes under that conjunctival surface that's now looking blue is something called a subconjunctival hemorrhage. And what happens here is there are little blood vessels that feed the whole eyeball, including that white surface. And oftentimes you don't see those blood vessels unless you have an allergy and they're dilated or something gets in your eye and it's inflamed. Sometimes those blood vessels can get a clot in them and obstruct. And when they obstruct, sometimes they burst and leak. Other times they're traumatized. But a person with sickle cell disease, as you can read on the left side here, is at more risk for subconjunctival hemorrhage than others. People who are on blood thinners, and sometimes sickle patients are, people that have high blood pressure, and sometimes that's an issue. But I want to point out that on this side of the eye, this is where knowledge is wonderful. This is where you can love your body. Like you say, Moses, I love sickle cell. I love that at least with that condition, it doesn't affect the inside of the eye area where the retina is with this particular type of hemorrhage, or the lens, or the iris, or even the cornea. This will spontaneously resolve on its own. You don't need to worry about it. You don't need to worry about it. But here's another problem. If it's not that problem, but if someone says, I can't see well, then you have to worry and take action and not love your eyeball so much, but love the doctor that fixes it. In the back of the eye, there's blood vessels that come in where the optic nerve is. If you have a crisis and it blocks one of these blood vessels, that's a medical emergency. You could potentially lose your eyesight with that. If we look at eyes, and I'm back at the various models here, I want to look at a different eye complication called retinal detachment. So a blood clot that affects the optic nerve. Notice this eye, it looks pretty darn normal. But when we look on the inside, this person, I'm going to enlarge it. And I'm going to look here where we have our SCD hub information at. I could take a quiz, by the way, if I wanted to, but I'll let you log in and take your own quiz. But this should be nice and smooth and affixed. This area here is a problem. And the retina somehow got damaged, possibly by a blood clot, possibly by something that damaged the lining of the retina, and the fluid in the eye snuck out and made a little bubble behind it, causing the retina to detach. When this happens, oftentimes a person might be seeing double, they might have pain in their eye, and they might have distorted vision, especially in one area of the eye of their field, but not others. If they covered their eye, one side will see great and the other eye might be very blurry or might not be able to see to the right or to the left. This is a medical emergency also. So I believe I stopped sharing. Is that correct?
You did.
Okay.
Yep.
So
I just wanted to make a quick comment.
yes, sir.
To follow up on what you have said, what you've demonstrated is the responsibility. When I say love yourself, is to keep your appointments. Find out from your primary care when you need to see your eye doctor, all these specialists. So you are taking care of yourself. You're taking control of your health. You're not just sitting on the sideline, wishing and thinking that things will happen automatically. And you prevent emergency room visits if you take care of these things. You are more proactive. That's what I learned from myself with my son. You take care of those things. You don't have excuses, and you train your own children or your loved ones on how they can transition to take control of these things. And because sickle cell affects the whole family. So when the family come together, there's so much they can do to the benefit of the person who has sickle cell and the family as a whole.
Oh, that's great. That's great advice. I'll just end my little session here saying, the more you understand about the form and function of your body and what's an emergency and what's not, what's happening and what's not only keep your appointments, but sometimes insist that I need an earlier appointment.
Right.
I've lost my eyesight. This pain is not me seeking a drug. This pain is the worst pain I've ever had in my life. And I'm afraid there's something major wrong with my eye or with the other part of my body. So it's okay to be an advocate, tracking things. Go ahead, Lucy. But
I'm just bringing up what you're talking about so that you can see that we've got the built-in tools. Let's just say, you did have a pain in your eye, and it's starting to happen more often. And instead of just trying to remember and then tell the doctor, document it, put it in right there. Open up the pain tracker. It automatically goes to time and instance. Of course, you could backdate if you needed to, or change the time. But right now, I'm just going to go ahead and track that pain that I just had in my eye. And what was it? It was like a sharp pain, right?
Yes, ma'am.
And it was in my head. I'm noticing we don't even have ion here.
It's time. Well, so that's the beauty of this. When you're using this app, send us your information. We'll update it and make it more relevant. We will add eye to the tracker. Thank you.
And what were we doing? I was working at the computer, right? And then the pain for this was pretty hard. I mean, it was pretty intense, a 7. Yeah. And I'll just submit it. And in the system, because you just lived it, right? You just invested 10 seconds to track a pain, then you will win 10, or you will earn, right? 10 daily tracker coins. Yeah. And Moses has been busy, getting sponsors and partners so that we could actually associate, prizes and gifts and gift cards, depending on how you engage with the app. So that was just an example. Now, let's say, for example, now I kind of want to see what's happening. So in notice, and part of the reason that we're doing this monthly insights is to give some insights as to how the app and platform work, right? To kind of tease you in, to show you some of the features, so again, for free, you can download this. And then even if you're a mother of a child with sickle cell, but I've used this app to track my own pain, right? So that I can show the doctor, wow, I've had 5 days in a row of this needle thriving pain in the back of my head.
And that's a key point there. And so let's just stick with that. When Moses said, keep your appointment, you don't just show up and sit there like some frightened sheep waiting for people to tell you what to do. You have to speak up. And what this tracker can help you do is say, I think I'm having trouble remembering it because I've had 6 or 7 issues. Let me show you. Bring up the app. This is what I had. This was on days with cold weather. This was on times when I was taking my Coumadin. This was at times when whatever it was.
I'm noticing I'm in
help-
as another user, so my submittals weren't showing. That is
Okay.
Coach Lucy's kind of a dummy user type of deal.
Yeah,
But
I guess what I'm saying though is help your doctor find patterns, be part of
Yes,
the disease
yes.
detective team,
Yes,
so they
yes,
can help you figure that out.
yes.
And again, we were showing on the website, but this is just the app version, how easy it is to come in and connect with those living with sickle cell. You can see that they are ran and moderated by physicians and volunteers of sickle cell. So again, just wanted to share some of that with you as we talk about that. So let's go.
Yeah,
Go
just
ahead.
wanted to make one more comment. You hear on television, you hear in the news saying, "Be an informed consumer." All the time, be
Mhm.
an informed consumer. Be a cautious consumer. Well, be an informed consumer. So what Dr. Gila was saying that when you go to your doctor, granted that you can also print the screen, capture that information and send to them, is the more you are informed, the more you are able to tell, show, or share with your doctor or care provider, the more they understand your situation. I don't want to share some of the things that I learned. Unfortunately, I didn't have this app. I wish I had this app 2010, 2011. I didn't. And in fact, when I first app that I use personally, I use it not for sickle cell, but for other things, because I'm the one who using the app. I can go put whatever symptoms I want related to what I was feeling. So you can make this app work for you very effectively, for your family and for you.
Very true.
And so I am bringing, so wonderful. So that accomplished what we set out to do, which is talk about what's going on, be able to demonstrate some of the things that you can do in the app. If I were to just add one last thing before we go to then a calendar and items up
Yeah,
here.
let's play a little bit.
The easiest way to kind of see all of the things that you would have access in your app is really from the bottom. Download this from the App Store. It's for free. So as soon as you activate your account, you're going to get a rich menu like this. If you look at the More button from a logged out perspective, you have not created an account, you will not see all of this stuff. You'll only see 4 or 5 options. But if you are logged in as a free member and you go to the More tab, you can see basically you've got a bunch of quick links. Let's say, for example, I am in the newsfeed.
Lucy, the More app is the 4 lines at the right hand at the bottom, right?
Yes, the 3. We call it hamburger menu or
It looks like a sandwich. So I'm worried about your eyesight. You saw 4. There's only 3.
Yeah.
Okay, the 3.
Exactly.
Thank you for bringing that up, though. Go ahead.
One of the cool things in developing this and working with your team, Moses, was this page particular. I think it was Akila, by the way, that said, you know what I would love to see? I would just like to see a glossary, just a real quick glossary of terms so I can really just kind of go through and very quickly, have a list. This is very simple. This is kind of like, wow, why didn't we think of that? But then if you wanted to tease yourself or test yourself a little bit, we got some interactive tools in here too. So there's some flashcard, type of capability. Destruction of red blood cells is, gosh,
Hemolysis.
hemolysis. I would have gotten that wrong. Wow.
Hemolysis. Take our medical terminology course. You know
Let's
that
say
one.
a genetic disorder where red cells become rigid and misshapen. I'm going to try and say sickle cell disease. But again, just kind of going through this and testing yourself, and you will earn points. So that's just an example of one. There's other things like exploring the body where you've got these kind of hot spots and you're trying to go through every single one. So if I click on the first one, This is fun. Because this is just memory matching. And once you memory match, it'll give you a little deal. Let's see, So I'm just going through jaundice, and then it'll give me a little. So that's just some interactive learning tool.
Well, it sure beats spending your time playing Candy Crush. Are you getting points for doing this?
Yes, of course. So I've got earnings and rewards built in here. I'm earning my Learn It coins, and there's just a little explanation on, how you could do that. Basically, anytime you learn something, the Live It coins are really just tracking. Every time you track, you'll earn. And then the Share It coins are really when you're engaging in the community, when you're sharing comments, you're connecting, and you're engaging in the community. So right now, as it stands, we actually have a couple featured challenges. And we were going to take this off the table, you guys, but it's still here, right? The opportunity to earn a $10 e-gift card and a player's card if you get to level 3. So that's the goal of this Reality Health Games challenge, is how many people can we get to level 3, which means they've done new member activation and they've earned a reward. So again,
along that line, Lucy, this app offers a great family time. I mean, I'm not going to say don't watch TV, but this tool offers opportunity to family to come together.
That's cool.
Any of these tools, any of these aspects of the tool, the family come together. So, I think in one of the other broadcasts we'll have the kids zone. So you have everything that you need to enjoy a good evening of a learning experience that is actually very, very productive and very enriching.
Yeah, I'm glad that you mentioned that, because we do have some fun games that will be launching here alongside this month and for World Sickle Cell Day. But let's spend the last, let me just check comments here, just making sure. Okay. And so the calendar, let's look at the June calendar here for a second. And before we do that, let's, because this kind of
summarize it,
puts it out there for us. So, and the Force for Health, we, again, are based in Arizona and Pennsylvania. We've got some activation in several states, but we've got several partners within our communities that we're working with. And a lot of the focus this month is about blood health, right? And some factor of it. And so we've been working very closely with the Southern Arizona Red Cross team and Team Lizzie Bell on blood drives and making sure that they're earning points by even hosting a blood drive. We've got this cool challenge up here that will challenge people to hula hoop for 8 minutes, right? It's called the Move Your Blood Hula Hoop Helix Challenge. You're going to watch a video. You're going to see if you can, move your blood and earn your badge in that regard. We do that out at the Arizona Bowl. We'll do it out at the Juneteenth Festival. But more importantly, you know what? I'm noticing June 14th. I'm going to take that graphic down and go straight to the calendar, because I just noticed that our dates change wasn't reflected in that graphic. So this Friday, one of the calendar items that we're excited about is a Arizona Community Roundtable that's really hosted and powered by the Southern Arizona Red Cross, Courtney Sloniker, who has been fabulous to work with. But then there's partners around like Sarah from Banner Healthcare, Health Plans, and the Dunbar Pavilion over there in the historic African-American community of Tucson. So much history down there. Arizona Blood Alliance, and of course the Arizona Achievers Foundation. I see. Moses, do you want to go ahead and speak to how important these types of community roundtables? Rob and I participated virtually last year on this, but let's talk about this. How much does it cost? How can people sign up, and what to expect?
This is quite exciting. We started this in 2023, if not mistaken, late 2022. Sickle Cell Roundtable was a forum that we come together, all the supporting entities Arizona Blood Alliance, Arizona Department of Health Services, the Red Cross, and it just kept growing. And we used to have it every quarter. We needed a forum to put the word out so that our community can be reached and motivated and encouraged, and they have opportunity to participate and also opportunity to promote advocacy. So each of these events will pick a topic. The organizing team would come together and we'll pick a topic, like we're going to talk about stigma in this particular case. But we are celebrating this. This is so wonderful because it gives us the outreach to work with the Dunbar Center. That's just amazing. And we are even happier because we are doing this in Tucson. No, we always had these events in Phoenix. So I am really, really excited that we're having this event here in Tucson. And so please sign up, register virtually, in person, and there's going to be a number of surprises. How about that?
And this is really for the entire community. So if you are living with sickle cell, if you're part of the medical community, or if you are part of the general public that just wants to know more about this, anticipated participation might be anywhere between 40 and 60 folks. We still have room in person. Refreshments will be provided and sponsored by Banner Health Plans. And just to give you a little bit more insight, so it's a 2-hour block of time. It's from 2 o'clock to 4 o'clock this Friday. The first hour will really be a keynote and panel discussion about what you just talked about, Moses: stigma, overcoming stigma, and that's featuring Dr. Knight, right, from Banner, alongside Sarah Speichermeyer, who is the CEO of Banner Health Plan. So then we will hear from Akila, right, on again, the extended topic of overcoming stigma and improving awareness, both for self, family, and then community. So really, that's the first part of it, right? Stigma, overcoming it, and really kind of coming together and owning the power to do something about your own health. The second part will then be fully dedicated to this platform, the app, the community. How can we engage and activate anybody there? How can we ask questions? How can we support? And how can they use the main pieces of the function? So there's going to be actually some hand-holding training going on. There'll be some live interactive challenges for those who choose to participate. So you may be walking away with a little gift card or a t-shirt or something. So
is this only an in-person event, or is this an online event also?
This is both. And you will see, highly encourage anybody that is going to come to go ahead and download the app for free just to kind of get started. But you will see on this link here, when you sign up, it will ask you specifically, let's just say I say Tina, Tester. I put my email in, Tina at, but it will tell you right here. Okay, let's say Tina at myhealthyglobe.com. I am with the Force for Health, and I am a other and community member, I'll say. Submit. Now, and save my response. It was interesting. When I did it the first time, I thought it did ask me if I was going to be in person or online. So we'll just maybe double check that with Courtney as these next couple of days run up. But it is meant to be virtual and in person.
Is this just a Arizona citizens event? Or as we are going out there to the sickle cell, you are the Sickle Cell Foundation of Arizona, and your focus is in your Arizona greater communities and providers. But can anyone anywhere in the country or the world download this app?
Yes.
Yeah, the answer is yes. We don't translate into other languages now. And there is a hyper focus right now on Arizona community building and the connection statewide, east to west, north to west. That is the hyper focus to create a model of connectivity, competition, and awareness. But sickle cell is the same in Georgia as it is in Arizona, as it is in Mississippi. Now, advocacy and regulations may vary in difference. But to answer your question, your leading question, partner,
Well,
yes, anybody can download it. It's not
It
translatable.
is a leading question because as I talk to some of my physician colleagues out here and others I train with back at Mayo Clinic and up in Minnesota, it's like, wow, I want to see what you're doing. Maybe that's, that might be useful in our community. And so even if you're not immediately engaged in an activity with the intensity of the teamwork that's going on in Tucson, Scottsdale, and Flagstaff, it's the first step in getting it going in your community. So feel free to download it.
Yep.
By the way, the background is not my house. I just
I want to move in there.
That's a virtual background. No, we are excited. We want to promote Arizona with this app. That's highest, and then the virtual aspect. Anybody can, the more the better. We really
you have wonderful local partners that I cannot say enough for Sarah Speakermeyer and others that are around the table supporting your efforts. Banner Health has just been Banner Health Plans gets it as a community engagement partner. They just get it. We're fortunate.
I'm always playing time cop here. So in the last few minutes, so again, the app is available for free. Download it and connect. We've got some events coming up. We spent time talking about what's happening this Friday, which is really a Southern Arizona Red Cross powered Arizona Community Roundtable, virtually and in person, from 2 to 4. But at the end of the month, I think it's pretty cool, Moses, that you guys are hosting. Now this is a Saturday to Sunday thing, and it's going to be held up in Phoenix. And this is really to serve the families living with sickle cell in terms of the folks that will be coming out and hosted. And you're even sponsoring hotel rooms and or meals. So let's talk about this.
Yeah, we are, for those who are coming 50 miles and beyond, especially those from Tucson. That's the reason the roundtable is so important, because we're having something in Tucson. I'm so excited. So yes, those coming from Tucson, you spend the night in Phoenix, free hotel, and then you have a $50 gift card, the addition to that. So, but we had already over 260 people ready RSVP. So please register on time, early. So that's quite exciting. There's something else that was left out in there because I didn't send it to Lucy. On June 19th, we always had a bi-monthly support and empowerment group meeting. We've had that since for a long time now. So we are going to have that. So watch out if you are in our email list. Kayla is going to reach out to you. You'll get the link to join the empowerment group meeting. That's another opportunity that we've had from the beginning, and we were so thankful because that's how we survived during the pandemic when we couldn't meet in person. We used to meet in person. So thanks to Banner UMC here in Tucson, we started meeting virtually, and that continues bi-monthly. So we're going to have that on June 19th, usually about 1 hour.
Okay, great. So let's make sure and get that up on the calendar. Again, 360scdhub.com is the site. 360scdhub.org It's the site. We actually purchased the .com for you also, so they'll both point to the same thing, but it is 360scdhub.org. If you go there on your mobile phone, it will actually just present a little banner up top, and it will take you directly to, depending on your phone type, to your specific Google or Apple Play Store. And then you could just download it, answer a couple questions, and join the community, and we're golden. So, final thoughts. Let's go around the room really fast here. Rob, we'll start with you as we close out June, leaning into it with the 360 SCD Hub.
I'm going to echo what Moses said. It's a family affair. Utilize the apps and the events and things that are occurring to enrich the quality of your family time. Sickle cell affects everyone in the family. Please be patient with everyone. Kids with your parents and parents with your kids.
Moses, final thoughts for June.
Yes, thank you so much. I just want everyone to know that dreams do come true. Sometimes it takes a longer time. Sometimes you have to go through up and down. But this app is a dream that has come true. So let's enjoy it and use it for our benefit.
I love it. And for me, I guess, as part of the general community, right, leaning into this, I always lean into June thinking it's halfway over, man. This year is halfway done. I just can't believe it, right? And so I like to just kind of stop and assess and say, what have I done the first 6 months? What am I proud of? What do I need to work on? And then let's repower ourselves for the last 6 months. And for me, this project and this month has me hyper-focused on blood, right? The larger topic on blood, and recognizing the nuances within that space that can happen, and sickle cell happens to be one of them. You can't catch it, so don't be afraid of catching sickle cell. It is fully, genetically transferred. And so I think that alone can go so far in terms of addressing stigma. And hopefully the more we can share that with people, then the more than those living with sickle cell will feel less, stigmatized, we'll call it, right? Because more people will understand they don't have to be afraid of them. Okay, it's not something that you can catch. It is a genetically passed trait that just happens to reshape some of the blood cells. And all it happens is they get stuck more often than regular blood cells. And those cause pain, crises. And sometimes people don't understand that. So I think that's what my takeaway is. The more you know, you know. And my focus is helping spread that message about sickle cell this month. Okay, so lots of different community events that we will be seeing you at, Moses, this month. Again, download the app. We'll have some exciting announcements starting this Friday on June 7th about some virtual health challenges. We'll have some fun fundraiser, announcements, because this app will need to be sustained, but it'll be fun to include the Sickle Cell Foundation in our, inaugural Reality Health Games type of a team and fundraising competition. So heads up for all of that. And we will see you next month. Got it? Take care. Be a force for health. Connect with 360 SCD Hub. And we will see you on the app. Take care.
Bye-bye.
Bye-bye.